Three reasons that we ACE wrap. We are controlling edema. The more sensitive will be the limb and the more likelihood there is of pain. The second would be to reduce the sensitivity, so it's desensitization. And the third is to reshape the limb, again keeping in mind that the dog ears, or the square corners that we often see, need to be reshaped in order to prepare the leg for prosthetic use, which will probably start in 2 to 3 months after the time of surgery. You want your snugness to be greatest distally and less so proximally. I will begin first by making sure I have already cut my tape, and I will hang it on the armrest. I will use 2 pieces per ACE wrap. I'm going to demonstrate what's involved in properly wrapping a transtibial or a below-knee residual limb. And first I want to point out that we want to remove the clips because of the points, and we have a lot of patients who are diabetics, so we are better to remove those, throw them away, and use tape instead. I find it's easiest to hold the wrap with the bulk of it up rather than down. It's easier to maneuver. I'm going to start on a diagonal. I'm going to catch the inside corner, bring it around. I'm pulling about 50% of the ACE wrap elastic, and what you should see is a U shape. I will then come up. I'd like to anchor it above the knee, so that when I come back down, I have a nice sweeping angle, because what we're trying to do is reshape the stump. This is actually a well-shaped stump. Typically after surgery, the end of the limb is much more square, creating what they call dog ears. And the prosthesis is actually more conical in nature, so we want to take the dog ears and use the elastic wrap to reshape the limb. So if you'll notice, I'm going in the same angle on my second go pass through as I did through my first, but it's not totally overlaid. I'm going to come around, try to get that bottom area. Okay, I'm not happy with this right here. That indicates it's not tight enough. So I'm going to roll again and reapproach that. It's fine to redo when you're teaching the patient, because you want them to redo what's not working properly. The only time you should really be using a horizontal angle is when you're changing directions. I'd like to get this area. Your goal is to get total coverage. And I'll start to work a little bit higher on the leg here. There's really no need to go above the knee more than the one time. And you want to go above the knee early on.